the presentation, I do want to start with the land acknowledgement. So we acknowledge the land we are meeting on is the traditional territories of many nations, including the Mississaugas of the Credit, the Anishinaabe, the Chippewa, and the Haudenosaunee, and the Wendat people, and is now home to many diverse First Nations, Inuit, and Métis people. We also acknowledge that Toronto is covered by Treaty 13 with the Mississaugas of the Credit. When we state a land acknowledgement, we reflect upon and demonstrate recognition of Indigenous land, treaties, and people. We think about what happened in the past, continues to happen in the present, and what changes we must make going forward in order to further the reconciliation process and building a positive relationship with Indigenous people. By making a land acknowledgement, we honor the land and Indigenous presence, which dates back to over 10,000 years. I myself actively acknowledge as a racialized person who occupies space on Indigenous land that I am responsible and accountable of my action, and it's up to me to make a choice every day how I honor this land. In honoring my ancestors and the colonial practices, I acknowledge that I carry the slave name that was given to me through the process of violence of people stolen from land and occupy space on land stolen from people. I acknowledge the mass incarceration of Black, Indigenous, and Indigenous people and commit to do the work to continue the fight against racism, colonization, and criminalization. So again, welcome everybody. Today we will be having session 2 of 5 of the anti-racism series. This session is called The Color of Justice, Recognizing Indigenous, Black, and Racialized Voices Within the Context of Mental Health and Justice Service, specifically the impact of building an anti-racist, anti-oppressive organizational culture. Today we have with us Shireen Ramprasad. She is the Equity, Diversity, and Inclusion Manager at Service and Housing in the province. She has worked with SHIP for over 17 years in many areas of the organization, but as the EDI manager since May 2022. She is also a board member of the Regional Diversity Roundtable Board of Directors. Shireen is a social worker who has spent her career working with diverse populations within the mental health and addiction and supporting housing field. Shireen is a community leader and advocate for enhanced access and services within the community that meet the needs of the people whom she serves. So yes, today I would like to introduce you, Shireen, today, and you can go ahead with your presentation. Please just be patient and give her some time to share her screen. Sorry, I actually need to just clarify. I do need you guys to have your cameras off and please remain muted. Also, the session is being recorded. We ask that participants give any questions in the chat and we will monitor the chat for the questions at hand. Also, we are asking if Shireen's okay with it, that she will leave the questions to the end. I did want to also go over the HSJCC mandate. So the mandate of the Toronto Regional and Local HSJCC is to engage in joint cross-sectoral planning, coordination, and integration of services for individuals with complex human service needs, which may include, but are not limited to, those living with mental health issues, substance use concerns, behavioral dependence, or neurodevelopmental and neurocognitive disabilities, including developmental disabilities and dual diagnosis, who are involved or at risk of being involved with the criminal justice system. There are 4 locals, so if you guys are interested, there's the West Toronto, North York, Downtown Toronto, and Scarborough HSJCC. Each local HSJCC is responsible for working together to address the local needs and reporting to the Toronto Regional HSJCC to help inform systems planning at a regional and provincial level. If you are from Toronto and interested in joining the Toronto local committee, please respond to the chat box and your email. Please respond to the chat box and just leave your email in there as well. And our coordinator, Dominica, will connect with you. Again, please mute yourself, turn off the video. If you have any questions, please have it in the chat. And we ask that you stick with this for the remainder of the presentation. There will be questions and answers at the end. And yes, thank you, Shireen, for your patience, and everyone. I'll turn it over to you. Take care.
Thank you. Thank you so much, Lena. And thank you, everyone, for joining me today. My name is Shireen Ramprasad, as Dana said in the introduction. My pronouns are she, her. And I'm really excited to be with you all today to talk a little bit about the impact of building an anti-racist, anti-oppressive organizational culture. So, I don't know why it won't move. Oh, okay, so that's a little bit about me as well as my contact information. And hopefully you'll be able to get the slides after. I'll be sure to send a copy of our slides to Dominica and to send out to you all as well. So you'll have my contact information as well. Our learning objectives today are really to learn how to design and implement inclusive organizational processes to foster that anti-oppressive, anti-racist practice within your organization. I'm going to go over some of the ways in which my organization that I work for, Services and Housing in the province, and I'll continue to refer to us as SHIP. It's just much easier with our very long name. And I really want to share with you some of the ways in which we have been able to include some of these practices into our organization. I want to share in a few different ways. So how to take individual actions. And so we'll talk a little bit about employee resource groups, how we've created safe spaces, and our real commitment to moving from performative allyship to meaningful, sustained action. And certainly we want to start with the historical context and the principles of equity. And then I'll take us through a little bit around our data equity culture that we have developed at SHIP and continue to develop, with some examples of how we use our data to develop action plans that are equitable and that promote justice and equity within our services. So a little bit of a profile about SHIP. First, certainly where I work as an organization that is a mental health and addictions organization, and we are a supportive housing provider. Our mission is to work to support those with mental health and addiction challenges, to increase their quality of life and live to their full potential through safe, affordable, community-based housing and services. Our vision is quality housing, quality services, and quality lives. And our values are compassion, hope, inclusion, respect, and professionalism. And we refer to them by an acronym, as we do in this sector and in these fields all the time. So our values, to remember them, most people refer to them as CHIRP. Our strengths in the organization, we like to believe that our greatest strength is our people. And so that's why we focus so much intentionally on the people and building our culture of the organization through the voice of the people. And we'll talk a little bit about that throughout the presentation. And certainly our housing is the cornerstone of all of the work that SHIP does in the community. As one of the largest supportive housing providers in Ontario, we take pride in providing safe, affordable, quality housing to the community that we serve. And then certainly our services are also that supportive piece of why our housing and providing supportive housing is so vital to the community, but also so successful for us. It's ingrained into our practices. And so one of the things that I'll talk about a little bit about is how do we ensure that our practices are serving community equitably and that you're building that intentionally into the way that you deliver service. So let's start with the impact of building an equitable culture on an organization. And this really is where we see how culture of your organization truly matters to the way in which you deliver service, but also to the way in which the people within your organization think about themselves and think about your organization and being able to deliver their services and do their work that they do through an equity lens. So I always start any conversation that we have about anti-oppressive, anti-racist practice needs to be grounded in these principles of equity. We have to understand what the true call to action that we all have is. So I like to start with this diagram, and many of you may, depending potentially on your age and sort of the generation that you belong to, you may find these diagrams familiar. I certainly do, and it's one of the reasons why I like to use this particular diagram when we're talking about the call to action around equity. I like it because it goes back to a book that was from my childhood that I have also used and read to my son, The Giving Tree, if you all recall. So these diagrams are reminiscent of that book. But what they really do is give us some grounding foundation of our call to action as service providers in community, especially in human services and justice fields. What you see on the first part of this diagram is a picture of two people who both want to get apples from a tree. And the reason why this diagram depicts inequality is because both people do not have equal access to the apples on the tree. If you look, the tree is bending to the left, so the person on the left is able to get apples from that tree. Maybe not easily and maybe not, to the best of their ability, but they're still able to access those apples. As the apples are also, because the tree is bending to the left, the apples are also mostly on the side of the left. The person on the right does not have any sort of access, easy or otherwise, to those apples on the tree. So that's a good example of inequality. When we move to our right, we see an example of equality. Equality means that we provide each person the same thing so that they can have access to the apple. So we've given both people the exact same thing. We've given them a ladder that is exactly the same with the intention of being able to, for both of those people to be able to access the apples. But what you see is that despite giving both people the same thing, equality, being equal, the person on the right still does not have easy access to the apples. There's still some work to do. The person on the left has easier access to the apples, but certainly the person on the right does not have that same equal access to the apples. Now we move to equity. So when we move to equity, what we're doing instead is looking at what do people need to be able to access the apples or our services in our case. So what we've done with equity is we've said, okay, we're going to give people what they need, not necessarily the same thing, but we're going to look and assess what does each individual need in order to have access that's fair. And so we've given the person on the right a larger ladder to be able to access the apples on the tree. But what do you notice about equity? Even though we have, developed something that is fair and equitable, the person on the right still does not have access to the majority of the apples on the tree because the tree is still bending to the left. The tree itself is still producing more apples towards the person on the left. So there is still inequity inherent because of the way that the tree is delivering the apples. So the call to action for all of us is not just to stop at equity. What we're going to talk about today is how do we build equity into our practices and ensure that they are anti-oppressive as a result of building equity into practice. But we don't stop at equity because we all know that there are inherent inequities within all of the systems that we work within. And all of our services that we're delivering are inequitable. So in order to move toward justice, which means reconciliation, it means that we change the system. It isn't just about providing people with services that are accessible and equitable. It means that we have to change the system itself in order to reconcile the injustices that the system is causing for people who are accessing our services. So the final picture shows what justice looks like. Justice means that we change ourselves. If we are the tree, our systems are the tree, then we need to change the tree. We need to straighten the tree so that it isn't leaning towards one or the other. And we still provide equitable access. So we still provide what people need in order to access our tree or our services, but now our services are in a way that is evenly distributed, that is easy for everyone. Even with some of the accommodations that we may need to make, the access to those services is still equitable because the tree itself, the system itself, is equitable. And that is how we achieve justice. So the true call to action is to build equity into your practices with the intention of changing the system in order to reconcile the injustices that are inherent in the systems that we all operate within and that operate on each other. So how have we been able to do some of this work at SHIP? And we're going to start with how, as an organization, we have developed tools that enable us to build equity into our processes. It's very easy, and I'm sure many of you have heard and speak yourselves around using an equity lens when you do things like develop policy or processes or programs for community or for the people that you serve. And it's really easy to say that, but the harder part is, what does that actually mean? What does an equity lens look like? What does it mean to use an equity lens? And how do you use an equity lens within your organization to build policy? So we really took that to heart at SHIP. We looked at that and we all kind of had different ideas about what building an equity lens into practice means. I took that question to our EDI committee. We have an EDI committee at the organization that I chair and that is representative across the organizations, inclusive of client and family members who receive services within the organization. So I felt it was the best place for me to start this conversation, where we have staff who represent different demographics, and we have clients and families on that EDI committee who also have different perspectives. So at that level, at the EDI committee, we took apart what it means to have an equity lens. We did some research around whether or not there were tools available to us to be able to apply an equity lens. And what we found is that there really wasn't anything that was very specific to what we were looking for. So what we did is we created our own. We created an equity assessment tool with the input and feedback and ideas from all of those representatives at the EDI committee. What our equity assessment tool does is it takes people through a process of how to build equity into your thinking and decision-making as you are building policy processes, groups, or programs. And what it starts with is the idea of looking at impact first and foremost. Who is most impacted by your proposed policy process, group, or program? Which groups are most impacted and how are they impacted by what you are proposing to do? And then it takes you through the process of looking at that impact through different lenses. If you are building a policy that impacts, let's say, those of different gender identities the most, and it impacts them negatively, then it follows that you should be consulting with them so that you can get and build into that policy what is needed in order for them to be treated fairly and equitably within the confines of the policy itself. So our equity assessment tool builds a process for you to build in an equity lens into your decision making. And we have found it very beneficial for our processes at SHIP, to the point where it is now a requirement for whenever anybody is creating or reviewing a policy, a process, building a group, or developing a program, that we must use this equity assessment tool from the very beginning. And that is one way in which we are able to ensure that the voices that are most impacted, the people that are most impacted by what we intend to do, are at the table from the start of the process. That we are not then just returning to them to get their feedback after we have already done something or created something that has impacted them negatively. So the equity assessment tool is a way to ensure that we are always trying to meet that call to action for justice, that we are not trying to do more harm or create harm that is already inherent in our processes and policies. Instead, what we're trying to do is reduce the impact of the harm that is inherent by building strategies with people most impacted. So that's just one way in which we have started to build an equity-based culture within the organization across our processes of policy development, program development, delivery of service. Whenever we're delivering groups, we also use this tool. And whenever we're developing a new process or looking at change management processes, we use this tool to guide us. So an example of this and how this tool has helped us to develop a process that is inclusive is our policy development process for our prevention of violence and harassment in the workplace when it comes to client aggression, harassment, and violence. This has always been a challenge for many organizations. When we started this process, we reached out to similar organizations within the human services field, human services and justice, to see if they had a policy already, to collaborate, to learn from others and what others have been able to do and how others view this type of a policy that really is protective of the organizational values, but also intending to protect the staff within the workplace while also ensuring that we are delivering fair, equitable, anti-racist, anti-oppressive services for everyone. That includes the staff. So when we started on this journey, we did our research. We reached out to other organizations. We reached out to the hospital system. We reached out to places that also provided services to populations similar to ours. And what we found is that everyone is struggling with creating this type of a policy and having a really firm understanding of what this means for an organization, and taking a firm stance on where we stand as an organization when it comes to aggression, harassment, and violence from clients towards our staff or from clients towards each other. So what we decided to do, because there wasn't a lot that we could build upon and learn from, we created a working group that is also representative of the staff within the organization. And the staff that sat on the working group wanted to. They were very invested in this work and wanted their voices to be heard. So we developed this policy together with the staff from the organization. The policy that we have is reflective of the organization, but is reflective of the values and the concerns and the issues and the recommendations that were brought forward by the staff within the organization. That working group then conducted focus groups with all of our teams. And we used one of the tools that we have at SHIP is called an ideas worksheet, and our ethics committee has developed this ideas worksheet. What we did is to take people through ethical dilemmas. And so we used that worksheet and adapted it to be able to run the focus groups that we did with this specific intention around client violence, aggression, and harassment. That worksheet enabled us to be consistent in those focus groups, ask consistent questions, and get consistent feedback. We also hired a consultant to sort of provide an opportunity for the staff that were not comfortable potentially in those focus groups with us. We went from team to team. So we hired a consultant for those staff that were not comfortable voicing their concerns or voicing their experiences in those settings with their teammates. And that consultant ran focus groups that were private and confidential with those staff that chose to want to attend those. What we received from those focus groups was a plethora of experience, and folks were sharing their stories about their experiences of violence with clients and their experiences of our responses and whether or not our responses were effective and whether or not our responses were aligned with their wellness and continued to support them. And what we found from our consultations and our focus groups was that we were not, and that the majority of folks within this organization who work in a very challenging field with a very challenging group of people, they were finding that we were not supportive and our policy did not provide enough support to be able for them to understand or for their voice to be truly recognized or for them to feel safe in their workplace. And so we incorporated all of those ideas, experiences, feedback, and recommendations into the development of the policy itself. This policy was written by the working group itself. The members of the working group wrote this policy, and then it was elevated to our leadership. So the policy, we have coined this ideology of for you, by you. We created this policy together because it is for all of us together. Our next steps are now implementation, and the recommendation from staff is that we also include training as we roll this policy out, training for leadership on how to ensure that our interventions and our responses are supportive. And this has made an incredible difference to the way in which our culture at SHIP looks at violence, harassment, and racism within the organization. We now have a firmer understanding of the ways in which you can move from being a racist, oppressive organization with oppressive and racist practices, because that is what people told us, to moving towards dismantling that racism and instead implementing strategies that are anti-racist and anti-oppressive. Another way in which we have done this, in which we build organizational culture that is anti-racist and anti-oppressive, is through our work on psychological health and safety. We recognize, and I'm sure you all recognize, that you work in a field that is very challenging and that there is an impact on all of our psychological health and safety. And that psychological health and safety is different for everyone. How we view our wellness, how we view our safety is very dependent on our identity, on our experiences, on how we feel represented. And so that is one of the things that we learned from our process with building this action plan, is that representation matters. We may all be doing the same job. We may all be working with the same population. We may all be in the same field, but we do not all feel the same when it comes to how we need to be supported and how our psychological health and safety is compromised. We do not all feel the same about what are the things that need to be done or what we each need in order to maintain our safety and our wellness with the work that we do. So that is one of the lessons that we learned through this process, is that anti-oppressive and anti-racist organizations understand and recognize that you can't have a one-size-fits-all policy when it comes to things that are for your entire organization. Representation matters, and therefore you need to build action plans and policies that are representative. And that is sometimes challenging because there are so many different perspectives, but they are all valid and they are all important. So when we embarked on this process to build our psychological health and safety strategy, we leaned into the for you, by you ideology that we had created when we were working on our client prevention of violence and harassment with clients previously. And so we formed another working group, and we had a call to action from our CEO for folks who wanted to be a part of this process of building this action plan to come forward. And we had an overwhelming response from the staff within this organization. From that, we created space for those who were most impacted, which are the people who work in this organization every day that are challenged and traumatized by the work that we do, to share their experiences and to develop their process and this strategy from the very beginning. And what we have been able to do is to take all of the 15 standards for psychological health and safety from the Mental Health Commission of Canada and work through a process of how are we going to speak to all 15 of those standards that is truly representative of the voice of the people. The staff in this organization created this. This is theirs, and it is for them. And our hope is that as we move through all of the goals and activities on this strategy, that we will start to see and evaluate the progress that we have made to create a more anti-oppressive organization where people do feel safe and where they feel that their wellness is a priority for SHIP. So we talked a little bit about building culture within an organization that's anti-oppressive and anti-racist through building equity into our cultural practices and into our ways in which we develop practices and policies in an organization. So now let's talk about the impact of having an anti-racist, anti-oppressive organization on individuals, because who matters most in an organization? The people that are doing the work. If they are not well, it is harder to do the work that they do well, and to serve clients well. So we see the impact on each individual in your organization transcend itself out to the work that they do. So it follows then that we need to start with the impact on those individuals that we are having in the ways in which we support them. One of the ways in which we have focused intentionally and prioritized individual impact is through our employee resource group. So I really wanted to share this with you because this is one of the things that I think differentiates us as an organization that we've been able to build into our framework and our fabric at SHIP. This recognition that people who work in this organization, the ones doing the work, the ones out there trying to deliver quality services to clients, the services that are anti-racist and anti-oppressive for clients that are sometimes very challenging, especially in those high priority areas like mental health and justice. They need to be supported, and they need to feel that we recognize that what they're doing and how they feel a sense of belonging is vitally important to how they are able to do their job. So one of the ways in which we do this is employee resource groups. Our ERGs are networks of employees that are formed based on shared characteristics or backgrounds, and they are sponsored by the organization. ERG members usually share common needs within the workplace. They're able to advocate for themselves, they support professional development, and then they have the ability to connect within the community in a very different way. Our ERGs are such a valuable part of our organization's understanding of identity and aligns with our mission, vision, and values. We really have used the ERG process as a way to ensure that people feel a sense of authentic value, that they feel that they belong to the organizational values and to the systems that operate on them, and that they have a voice to be able to create actual change. So the ERGs that we have at SHIP we have a proud ERG that is for members of the 2S LGBTQIA plus community. We have an ERG that we call allyship at SHIP, and really that ERG focuses on bringing people together to support each other. We have a BIPOC caucus, which is Black, Indigenous, and People of Color ERG. We have an ERG abilities, which focus on accessibility and people with disabilities and ensuring that we are the most accessible organization that we can be for everyone. Our Live Well, Work Well ERG focuses on work-life balance and family structures. And then we have an Enviro ERG that really focuses on trying to bring to SHIP sustainable measures in which we can reduce our carbon footprint and ensure that we are environmentally responsible. So focus of ERG is about elevating the voices of employees from groups that are underrepresented or historically marginalized. And so that's why we have the six ERGs that we have. And we started at SHIP with a few. We started with three ERGs, and we tried them out and we saw what the interest was. And then we started having our staff give us some ideas about what other ERGs they'd like to see us. And we have grown to these six based on the feedback and recommendations of staff that were interested in either starting an ERG or being a part of an ERG that is focused in some way. The membership of all of our ERGs is not limited to staff who identify with these groups only, but all of the ERGs are inclusive of allies who want to help elevate the voices of whatever the ERG represents. Some of the things that we have been able to do, and I think this is an example of how individuals also then contribute. When people feel that they matter, they then contribute to the overall organizational culture. Our Proud ERG has been able to organize and celebrate at Celebrate Your Awesome in Dufferin. We represented at Peel Pride. We provided folks with promotional materials that they could then bring to their organizations. We have partnered with organizations in the community who specifically serve to us LGBTQ plus IA plus folks so that we can learn and that we can build our capacity as an organization as well. And that work has all been carried out through the Proud ERG. Our Enviro ERG holds Earth Day events. We have had a massive cleanup day across all of our sites at SHIP, where we ensured that we provided resources for folks to do a cleanup in our buildings. We were the recipients the Caledon grant for a pollinator garden at our Peace Ranch location, which we were able to build last year. And hopefully we will get this grant again to be able to build additionally onto the pollinator garden, an Indigenous learning garden in partnership with Indigenous groups in the community. So that's one of the things that we have been able to do through the Enviro ERG. And these are all ideas from the staff within that ERG who are members of that ERG. These are not SHIP-generated ideas. These are SHIP-supported ideas. Our BIPOC caucus has developed an anti-Black racism action plan for the organization. We have held focus groups specifically for Black staff within the organization to be able to speak to the issues that they face, the concerns that they have, and their experiences of racism within our organization. Those focus groups were held and facilitated by Black staff themselves. And we were able, from what we heard in those focus groups, to develop the Anti-Black Racism Action Plan for the organization that really spoke to the concerns and the things that we were hearing from Black staff impacted by some of our policies and our processes. And certainly we have been able to offer to some of our staff the Black Health Primer, which is a fantastic course if you are looking for a course around anti-Black racism and healthcare and the Black experience in healthcare, that I recommend that course entirely. It is online and there is a cost associated, but it is well worth it. We learned so much, the members that took that course that we supported. Our ERG Abilities has been able to develop an accessibility action plan for the whole organization. We had an accessibility audit completed by a third party that the ERG Abilities members recommended and that we were able to garner support from the organization to do, which led us to be able to ensure that our washrooms, our entrances, our training facilities, our website are as accessible as possible. it really has changed the perspective that the staff in this organization and the people entering our organization have around what accessibility means. And it isn't enough to do just the bare minimum. All people, no matter what their needs are, should be able to access your facilities and your spaces without having to ask for an accommodation. And that is what propels us. We want to be anti-oppressive from the beginning. We do not want to have anybody ask us for something that they may need because we haven't already provided it. So I take us back to the tree diagram. This is one of those ways in which we are trying to change the system, change the tree instead of having to provide resources or other things or accommodations to folks. We're changing the tree. We're making ourselves accessible so that folks do not have to ask us for anything. And that's one of the ways in which we are meeting our OADA compliance. Allyship, we have had some great conversations with staff in this organization about the ways in which some of our policies and even some of the system level policies impact them. And one of the areas in which we focused on was around flexible statutory holidays. So the idea that our stat holidays in this country are really designed around a Christian calendar was really impactful for many of our staff at SHIP, and they brought this forward as an issue. So we did some research, we consulted with a few people, and what we developed, the Allyship ERG developed a proposal around how we can have flexible statutory holidays within the organization, where you would be able to, if you did not celebrate a particular stat, you would be able to trade for a celebration or an observance that you wanted to trade that stat for your observance day. So that's something that came forward through the Allyship ERG that has actually really seen quite an impact on people, because that idea that you belong and that your needs are valuable and important is shown through having something like this be a possibility for us. Live Well, Work Well focused on last year, we were able to conduct 2 walking challenges promoting movement as being a part of your everyday work. The idea that get out and, walk, take care of yourself and do it on work time. Get out and take a walk, because if that's what you need to do, then that's what you should be doing. We had 2 walking challenges, and over the course of those 2 challenges, over 6 million steps were taken by the folks in this organization, which is amazing. So we've established ERGs at SHIP as a foundational piece now. The staff in this organization no longer look at our employee resource groups as an offshoot. It's not an initiative. They are inbred into what our expectations of ourselves are in the organization. Those opportunities to have safe spaces where you can come together with people who are having similar experiences as you and share those experiences, but not just share them, do something about them, have meaningful action, follow your sharing of experiences, and be a part of bringing forward meaningful action is really important, especially when we're looking and you see the ERGs are all representative of equity deserving groups. And that's what was identified to us, is that those spaces do not exist at SHIP, where folks from traditionally and historically marginalized groups, equity deserving groups, have space to be able to advocate, to be able to share their experiences, but more than that, to be able to bring forward their recommendations and actually see something happen to facilitate change. Our ERGs have provided us those opportunities to elevate those voices that have not had that space before. And that is another way in which we build anti-oppressive, anti-racist practices here. And that then has enabled us the opportunity to look at how do we do this for clients? How do we've seen the impact on individuals within this organization. How do we now have that impact transfer to the work that we do with clients? So the next thing that we are planning to do is to create client resource groups, where clients also have the opportunity to come together in these groups to support each other, but also to elevate their concerns and their recommendations to the organization for us to take action. Another thing, another way in which we build anti-oppressive practices within the organizations that impact individuals is by having safe spaces. At SHIP, we have had safe spaces since 2021. What we did is we started safe spaces because there was a need for our community at SHIP to come together and support each other during those challenging times that we all remember. What we had happen is that several of us took a workshop through Healing Circles. That is it's an organization where guidance and practice on holding healing circles was provided. Healing circles are a principle or something that is very particular to Indigenous community. So we learned in those workshops about the practice of healing circles, but recognizing that we are not Indigenous and we're not an Indigenous organization, what we did was we adapted our learnings and created safe spaces based on the principles of healing circles. And that because we recognize that we do not have representation from Indigenous community at SHIP. So safe spaces were created back in 2021. So based on the principles of Indigenous healing circles, where Indigenous folks come together to face challenges, provide space to decompress, support, and promote healing, we created safe spaces where we can come together for folks that are interested. And it's an opportunity to have your voice heard, to share your experiences with your peers, and to provide support for each other through issues that may arise during the discussion. Our facilitators are trained and have developed a format for safe spaces that creates safety first and foremost, and there are a number of different ways that we do that. Our spaces promote healing and wellness, and they really do focus on the participant needs and how each individual is able to voice those needs and how we as a SHIP community can support those needs. The conversations are meant to happen organically, but sometimes can be prompted by the facilitator in order to offer space to share. And usually we ask the question, what's on your hearts and minds right now? The role of the facilitator is really to maintain safety within this space, and there's a number of ways in which we do that. But to certainly provide opportunity for those that may not feel comfortable bringing forward their concerns or their experiences to the overall organization, to provide that opportunity to still feel safety and to still feel supported by their peers. Another thing that we offer at SHIP in a way to build and ensure that we are having the opportunity for those that want this space is we have started to look at brave spaces. Brave spaces are different from safe spaces. Brave spaces encourage dialogue, recognize difference. We hold ourselves accountable to the work of sharing your experience and coming to understanding. It's very challenging, and the intention of brave spaces is to tackle uncomfortable situations, uncomfortable challenges, and certainly many of the brave spaces that we look at are to tackle those uncomfortable sort of systemic issues that we all face. They're also a way for conflict resolution or looking at challenging world events and world things that are impacting people within your organization and within your community, and a way to unpack some of how people are feeling about that. They're usually formed for a specific reason, and it's not intended to create consensus, but it is intended to look at what our goals are, look at resolutions, and look at ways in which we potentially can change the system in order to be able to ensure that we are having a more comfortable space, a more authentic response to certain issues. So brave spaces have also been something that we are endeavoring to do at SHIP. It is challenging, I will not lie. brave spaces are very, very challenging and can be hard for facilitators to also create spaces that are safe for these discussions. So I just wanted to bring this example forward because this is one of the ways in which, brave spaces are really one of the ways in which we are hopeful to tackle some of the racism that is still occurring within our organization in a productive and meaningful way for folks. That is also, I think, with the intention of looking at systems change at the systems level also. Another area in which you can look at how do you, get feedback and ensure that the voices that are most impacted are able to provide you with that feedback is by holding focus groups. And I'm sure many of us are already doing that. Focus groups really help us to bring people together and gather feedback for a particular reason. We use focus groups and not safe or brave spaces when we are intending to develop a policy, when we want to create a process, when we want to get, meaningful feedback about concerns and issues that are affecting a lot of different people, but from specific groups. And then certainly we'll hold focus groups for improvement initiatives. But we make the distinction between whether or not we're going to have a safe space, a brave space, or a focus group, depending on what the issue is that we're facing. And so we have really developed for people this idea that there's always opportunities in different ways for you to be able to voice what your experience is and what the impact is that we are having on you, even if it's negative. The other thing, and I don't have a slide for it, but I will mention, is that another way to create anti-racist and anti-oppressive practice and culture for individuals is by also providing the opportunity to remain anonymous when bringing forward your concerns. Many of us know that belong to equity deserving groups that no matter how organizations shift and change, there is still a lack of trust that is inherent in our experience. And there's also that skepticism about whether or not authentic change will happen. And so for many of us, that safety of anonymity, but still having the ability to have your voice move forward is important. So what we have at SHIP is a program called Face Up that is a third-party program where people can put forward their anonymous concerns in writing through the app, and it goes directly to our CEO and our CFO to address within 48 hours. So that's another option of a way in which you can create safety and create safety, particularly for those that are impacted by racism and oppression within your organization. One of the things that we recently embarked upon was creating a belonging poll that we used at a staff day that we had last year. This poll, you could be anonymous. We used Menti as our way of delivering it. And we did it at a staff day so that folks could be together and support each other as they potentially would be impacted by the questions that we were asking. We asked about whether you're able to bring your authentic self to work. And if you are not, what are the barriers that you are experiencing? And what areas and aspects of our workplace culture contribute both positively and negatively to your sense of belonging? We were able to get an overwhelming amount of responses from folks that felt safe enough to respond to this poll because it was anonymous. There was no identifiers within the poll. And so we were able to kind of take from this poll the ideas that people have about their experiences and to build some meaningful processes that are inclusive and actually make some meaningful changes to the ways in which we look at even our orientation process, our onboarding process, the ways in which we look at supervisions and how people experience our supervisions and things like that. Okay, we've been doing a lot of talking. I hope you're all still with me. I know I'm going through a lot of different material, but all of it is just equally as important. And so finally, we're at that piece where we're on that last box in that diagram that I showed at the beginning around justice. That call to action around creating justice for folks in your organization must include the impact on community and systems because decolonization matters. In order to create a just system and just programs and organizations, we have to decolonize what creates the inequities to begin with, what creates the racism, the oppressive practices to begin with. We have to look at the systems themselves, the reasons why the systems are developed, all of the systems that operate on people in our community, all of the systems under which we operate are built on colonized practices and processes. They are built on the process of colonization, which means that they are not built to be equitable. And we are still operating in processes of colonization. So I have for us some examples of the historical context of racism, especially within our field. Healthcare and justice are based in the scientific racism that has perpetuated the ideology that we are just in how we practice because the data tells us we are just. Our data tells us that we've collected over years tells us that we are being just and anti-racist. But if you look historically on how data has been used and collected inequitably to perpetuate racism and to perpetuate inequity, to perpetuate stereotypes, you have a much clearer picture of whether or not our systems have been built upon true equitable data. So I have some examples. The 60s scoop for our Indigenous communities. Western science has been a major tool to justify and sustain processes of colonization, serving as a tool to justify racist policies of subjugation. Data collection for government agencies has been used against communities to pathologize and take action against them. So the 60s scoop is an example of that. Data was used to extract children from their families in the residential school system during the 60s, where they looked at the data, the evidence that they collected inequitably from a colonized lens to justify removing children from their homes and from their families and putting them into residential schools to be abused. That all went back to data. We looked at data and we said, this is what we need to do, and this is how we can use the data to ensure that we can do what we can do to assimilate children to the Canadian ideology. Another example from the Black community is the Tuskegee syphilis studies. And there's certainly a lot of information that you can access if you want to know more. I've kind of just pulled out the basics for these examples. Rather than simply observing and documenting the natural progression of syphilis in the community, as has been planned through the study, the researchers intervened, first by telling the participants that they were being treated, which was a lie, and then again by preventing their participants from seeking treatment that could have saved their lives. And this study was primarily conducted with Black males in the United States in this study. And so there was an abuse of power throughout this study that we can look back on and recognize why then do folks from the Black community not trust the healthcare system? If this is how they were treated, and if this is how data that they willingly shared with the researchers was used against them. Another example is the SIMS gynecological research study. SIMS research was conducted on enslaved Black women without anesthesia. Medical ethicists or historians and others say his use of enslaved Black bodies as medical test subjects falls into a long, ethically bereft history that includes the Tuskegee syphilis experiment, and then Henrietta Lacks, which I will talk about next. So Sims is also, Dr. Sims has been credited with creating a lot of the gynecological tools that are still used to this day. Those tools were created by abusing Black women. And so we credit him, we credit his research with some of the practices that enable us to save lives and to ensure gynecological practices now, but to what end? They were only developed because he had access to enslaved Black women who did not have choice. And so he was able to create things that we still use to this day based on racist practices. And then Henrietta Lacks. Henrietta Lacks was a Black woman. Her cells were collected at a hospital. The hospital was one of the only hospitals that would provide medical care to Black people. And her cells were then, used to create technology that many other companies and many companies to this day have profited from because her cells were very unique. They're called helo cells to this day. For decades after her death, doctors and scientists repeatedly failed to ask her family for consent. They revealed her name publicly. They gave her medical records to the media. They published her cell's genome online because they were so unique, and they enabled so much research to follow that the family and her were never compensated for. So why do I give you these examples? Because these are all examples of scientific racism. These are examples of how data in a colonized system has been used to perpetuate inequity. And if we continue to do the same, we are doing exactly what we have heard about today. One of the most effective tactics used to justify anti-Black racism and white supremacy has been scientific racism. Through the years, scientific racism has taken many forms, all with the goal of co-opting the authority of science as objective knowledge to justify racial inequality. It isn't just in healthcare that we see this. If you read a lot of the research around the justice system and the inequities that exist in the justice system, you will see how scientific racism has perpetuated injustice for Black community, Indigenous community, and the 2S LGBTQ plus community. A lot of the research that they base their numbers on was conducted inequitably. And it also was conducted with the intention of perpetuating inequity. It was conducted with the intention of justifying why it is that there are more Black folks represented in the justice system. There are more folks with addictions represented in the justice system. So we need to be cognizant and aware that much of the ways in which we look at data and collect data is ingrained in this colonized system that we all operate with. I put up here the 7th generation principle and intergenerational trauma on purpose, because what the 7th generation principle talks about in Indigenous communities is this idea that trauma experienced by one generation of people continues forward for 7 generations and is experienced and passed forward over 7 generations of people if it is not dealt with and if there is no intervention. So that's 7 generations of harm that has continued and been perpetuated over time. And we all know that this kind of principle leads to mistrust of systems, to inequities that are built in, that are very challenging to dismantle. And that is why I have this here, because to remind us that when our folks that are racialized, when the folks that come to us for services that are from Indigenous communities, that are from marginalized communities, overrepresented communities in the justice system, they come with an inherent mistrust of the system itself that is steeped from generations and generations of historical trauma that have been experienced by these groups in particular over time. So it is not about whether or not that we are doing the right thing and ourselves as service providers. It is about how are we dismantling that inequity, though that trauma that has created the mistrust of the system itself. The only way to do that is to begin to work on dismantling the system. We can do our work and we can have best of intentions, but our work is still within a system that is traumatizing people, a system that is based and inherent in colonization, a system that is inequitable because it was designed to be inequitable. So, in order to begin that journey of decolonization, we have to look at our approaches within that system. And we have to look at how are we meeting that call to action towards justice by reconciling the things that that system has created and that we have learned to work within. A lot of the times that takes a very different approach and it takes action. It takes dismantling. It takes the idea of knowing that people do not trust you and how do I gain and rebuild that trust. And that's what we're going to talk about a little bit next. When I talk about data equity, I talk about ways in which we can begin to regain that trust from communities that have mistrust in our system. When we ask questions about demographics of our clients, I know our intentions are good. We want to be able to know and understand who people are so that we can better meet their needs in any of the systems in which we work. It assists us in connecting and aligning the unique needs of our clients based on their identities, which better enables us to provide services tailored to meet those needs. That makes sense to us. The goal of collecting client demographic data is to improve care in a broader scope. This data can be a powerful tool in dismantling systemic barriers that exist for clients within our services. We know that, and that is our intention. But if we do not collect this data equitably and are transparent in what we are doing with this data, if we do not know what we are doing with this data, then we continue to breed that mistrust. We feed into that mistrust that already exists within particular communities. So it is so vitally important that we know why we collect demographic data and that we are able to articulate to the clients and the people that we serve the why. What are we doing with your information? Why is it going to be helpful and beneficial to you? So some of the ideas and some of the things that we do at SHIP is that we identify inequities using our data. We develop policies and practices to speak to these inequities within our system. We monitor and evaluate our interventions. And when they are not working, when they are not effective, we adapt, we change, we ask. We hold ourselves accountable for improving outcomes, and we intend to facilitate system level changes. We make that very clear that this information, the intention is to dismantle the inequities that you are experiencing as a client of this organization. Our demographic data can be used to inform prevention, intervention, and strategies to protect human rights. And that is what we tell people, because that is truly what we are doing with our information. I want to give you a quick demonstration. I know we're running out of time and I'm doing a lot of talking, so I'm going to go through this very quickly. What you saw there was our dashboard. That is our data dashboard that we use at SHIP for when we collect data to understand and analyze our data. Are you all able to, can someone let me know if you're able to see the data dashboard?
Yes, we are.
Awesome. Thank you, Damika. So our data dashboard at SHIP is where we collect all our socio-demographic data for clients. It is inputted by staff into the CRMS system, so our data management system at SHIP. And this dashboard collects all of that information and makes it graphical and visual for us to easily look at it and use it productively and effectively. So what you're seeing here is all of the elements, the socio-demographic elements that we collect at SHIP about the clients that we serve. This first page of the dashboard is the alignment rates. for each of these elements. And our overall alignment rate is 86% as of right now. The dashboard is live and updated every night. So as folks are putting information in, it is updating. So we, at any given point in time, know who we serve and who we are in this organization. It isn't that I have to run a report, it is here at the ready. So I can speak to different areas and different demographics at any given time, which is vitally important for us because we need to know who we serve and who also are we missing? Who are we not serving and why? Why are folks from particular communities unable to access services at SHIP? Why do they not want to access services at SHIP? And what do we have to do to rebuild that trust with them in order for them to feel better able and comfortable accessing our services? So this first one is just alignment. This is whether or not we have the data and how valid it is. So you'll see here with language, we're at 96.91%. So we're really very well aligned. We know and we can be very confident that in our language element here, that this is very valid information and very valid data. If you look down at legal status, we're fairly well aligned as well. We have 85%. So we know 85% of the legal status of our clients in the organization. The second page of the dashboard, you can break it down by staff and their caseload. I'm not going to show that because it has identifiers on it, but that second page is where leaders can go in, break it down by staff and their caseload, clients on their caseload, and look at where there potentially is missing information and what the reasons are why we're not asking about that information. If there's some discomfort, either on the part of the staff or the clients in particular areas, and start to work through that a little bit. And then the final pages are the actual demographics in real time, like I said. So when we look at this final page, our data tells us so many things. I can take this dashboard and look at all of any given element and start to look at where we stand with that community at that time, and if there is work for us to do. Are there inequities inherent that we need to be looking at and prioritizing? Are there communities that we are not paying particular attention to? And if there are, what is our strategy in reaching them? What is our strategy in getting their feedback, building their trust? So for example, for ethnicity, we are at SHIP right now with the 900 and something clients that are in service with us. 33% identify as white North American, 17% identify as white European, almost 14% identify as Black Caribbean, 6.17% identify as South Asian. So when I look at that, I can say to myself, the communities that we serve include Brampton, Mississauga, Etobicoke, York, Dufferin County, and Kitchener-Waterloo. Does this make sense? Are we reaching the people in those communities that are potentially need our services? Does this actually align with what we know those communities are represented by? So when we look, especially in Brampton, which is over 60% South Asian identifying, in our current clients, only 6% identify South Asian. So is that a community that we need to pay particular attention to? Do we need to look and dive a little bit deeper in why potentially they may not feel comfortable coming to SHIP for services or inquiring with SHIP about services? So this is how we use our data to look at areas of inequity that we could potentially prioritize and start to build better relationships with. The same goes for other areas as well. Let me just move to the next one. So you can also take a look at legal status here. So 70% of our clients identify as no legal problem, 2.8% are on probation, 1.65% are awaiting trial or in a court diversion program. We have all of the categories here that you can take a look at. And if you click on them, you can dive a little bit deeper into each category. And you can start to look across different dimensions on representation in each category. For those that are on probation, you can see that 17.86% of those clients that are on probation are educated to a high school level. You can look at household income. I can look at ethnicity. I'll go back. So if I go back, I can look at what those, oh, sorry, I didn't do it right. But you get the point. So I can look within each of these elements and do cross-referencing with other elements as well. It's very helpful for us to be able to do that at SHIP. It provides an opportunity for us to be able to see who we serve, who we're not serving, where inequities lie, which communities we are not benefiting or reaching, and how we're able to dismantle those inequities to the best of our abilities, who we need to speak to about that, and who we need to consult with. Okay, we're almost there, I promise. I know I've done a lot of talking and probably tired of hearing my voice now. So finally, we are at this place of how do we put equity into action? Some important takeaways, I think, are ensuring that representation is at the table for decision-making around changes so that you can make changes with an informed approach. Build the client voice and staff voice in wherever possible, and develop and build sound data collection processes where data is understood using equity principles. Refer to your data to ensure changes are evidence-based. Take your time and build foundational pieces using inclusive tools, like I referred to in the beginning. And remember that an equitable approach requires intentional, meaningful action informed by those most impacted. That's it. So thank you, merci, Megwitch. You can connect with me if you would like at any time. Like I said, my contact information is there for you. And certainly ready to take any questions that people may have.
So we do have a question. Thank you so much, Shireen. In the chat, we do have a question. I just want to remind people, please, it's a 1-minute evaluation. If you could just click that link. That being said, Shireen Noah is saying, can you share a bit more about how you collected all this data? And was it through interviews or surveys? And was it mandatory? He also stated, I can imagine it could be overwhelming to collect so much info from your clients. And how do you arrive on all the categories, options, language, etc.?
Awesome question. So
Thanks. Yeah.
what we didn't have time for me to get into it even more, but I do also do a workshop around data equity and data collection that goes into that a little bit further. But the data that I showed you on the dashboard, we are actually required because we are a health-funded organization. So the Ministry of Health and Long-Term Care requires all funded organizations to collect for mental health and addictions funded organizations to collect what they refer to as MHA-PDS. MHA-PDS is Mental Health and Addictions Provincial Data Set data. So that dashboard and all of those data points are actually required, mandatory by our funder that we collect all of that data. So what we have done is taken all of that data and it's built into our database, which is CRMS. And so what we have done with our sort of program at SHIP to increase capacity for staff, but also to increase the knowledge base around data equity, it's easy to take that list of data elements and just go with a checklist to a client and say, I got to collect all this information about you and, just tell me this, this, and this. But what you find with that is that you do not build relationship, you do not build trust, and you'll have a lot of clients refusing to answer those questions, rightfully so. So what we do at SHIP is we have an entire training program that is also required. It is mandatory for all direct service and support staff to take our data equity training, where we go through the process of building, similar to what I've talked about with you all today around data inequity. And then we go through a process with staff, the technical aspects of collecting the data. So how do you input it into CRMS? What each of those data elements mean, and what we're referring to, as well as we go through the how and the why of collecting data. At SHIP, we've adopted a different way of data collection that is grounded in data equity. We don't ask questions of our clients. We don't bring a checklist. What we do is build relationship, and there is no time frame, truly. There is, the ministry requires the data be updated every 6 months, but that just means updated. What we say to folks in our training is that it isn't about asking questions. You're not going to build trust and relationship, particularly with people who have experienced inequity from their data, like we talked about with scientific racism. You're not going to be able to get information about them that will benefit them if you just come in with a checklist. So what we do is we train folks on how to make the offer. We offer space for clients to tell us about themselves. And we take from those conversations this data. We try to give clients an opportunity to let us know who they are by creating a space where we're honest and transparent with them about what we do with their information, the successes and the challenges that we have had using their information, the challenges like I talked about that are things like, who are we missing? It doesn't make sense to me that Brampton, a population who identifies as 67% South Asian, and in our client population, we only see 6%. Why is that? So we're very honest with our clients, and we encourage staff to be honest. And we encourage staff to have conversations that are not just about collecting data, but are about getting to know people, and the reasons why. We want to get to know people. That's part of what we do. And so that's how we approach it. And our training goes through that. Staff have an opportunity during the training to let us know their discomfort, to let us know the areas that they are most uncomfortable with talking about, and we problem solve with them. We offer them support in how we can go about beginning those conversations, or there's also the option in CRMS or in those data points for asked but declined. So our request of staff and our expectation of staff in collecting this information is that they make the offer always. Even if you're uncomfortable, make the offer. The client always has the option to decline. It is their right to decline. Their information is theirs. But we ask that you make the offer. And then if the client doesn't want to answer, that's fine. We respect that. But then you can at least fill in that data point. So we know at the end of the day that we can revisit it at another time. As you build more trust and relationship with clients, then the opportunity will hopefully be there for you to revisit what they didn't want to talk about before. So that's our approach to collecting that information. And yes, we have to. All of the sort of options are created by the ministry. So they give you all of those options, and they give you all of the information that's in the drop downs. The options are all created by the ministry. Hopefully that answers your question.
Thank you, Shireen. Great presentation. There's some thank yous in the chat going on. So yeah, I thank everybody for being patient, going through this hour and a half presentation. It was very insightful. Like Shireen said, if you want to connect with her, you can. And again, just a heads up, if anybody is interested in the becoming a member of one of the locals, then they can also contact Dominica for that. So reminder, please fill out the evaluation that's linked in the chat. And we thank you all for coming, and we hope that you have a good day.
Thank you. Thank you, everyone.
You all.